Awesome. Okay. So welcome. I'm Angela, and Lael and I are going to be co-hosting this little class or workshop tonight to talk about a Clearwater health share plan and the relationship that Clearwater has with Young Living Essential Oils, which is a company that I'm a distributor with. I've been with Young Living using the oils for 10 years, and I have been sharing and teaching others about them for 9 almost in the beginning of 2025. I'll be hitting the anniversary of both of those. So I love it. And recently, Young Living, just earlier this year in 2024, Clearwater and Young Living created a partnership and a relationship, which I'll talk a little bit about as I'm going through the slides here, but really as a opportunity to help people to save money, but also be able to be proactive and take their healthcare into their own hands. So I'm pretty excited for it. I'll even also share my example of my family and how we've saved a lot from switching from traditional health insurance to the Healthshare, and it's been pretty massive in the savings that we have for our family. So again, thank you for being here. I appreciate you.
Thank
Okay,
you.
so a little bit about who is Clearwater to start with. So this is a health share company. It's a nonprofit. It's been around for 6 years. Earlier this year, the member count was 50,000. It's grown since then. That's about 6 months old, that data. And why that's important is because all of us who are members with Clearwater are paying in a monthly premium to help keep the costs low. And obviously, the more people there are, the easier it is to share those healthcare costs and then prevent monthly premiums from having to go up. So Young Living created that partnership earlier this year and really is working with Clearwater to disrupt the healthcare industry and help us all be able to get the care we want and need, but also at an affordable rate. So pretty excited for that. A health share is a group of people who share the costs of medical expenses and can take monthly contributions that are paid, and those are in place of traditional insurance premiums. And the health share is a nonprofit with Clearwater, so that the goal isn't to make money. The goal is to help keep costs low, and actually as a nonprofit, for them to keep their nonprofit status, they can't make money. There's like limits on how much they can profit beyond paying and covering the bills and taking care of employees and that. One of the things that's interesting to kind of be aware of is the a lot of us are used to the term deductible with traditional health insurance. We have a deductible and then we have a max out of pocket. With a health share, there's only an annual max. So whatever amount you choose, 1,000, 2,500, or 5,000, you pay that amount before sharing starts happening among your medical costs and that. So then really once you've met that amount, pretty much everything is covered at 100%. An example that is different than that is if someone is a smoker, then there are limitations on coverages that they receive for ailments or sicknesses related to them being a smoker. So, like a lung disease would not be fully covered. There are limitations on that. But really, most things, and I have a list on one of the later slides, are covered at 100%. So, and shared amongst the others. This slide I really like is a comparison of what is a health share versus traditional insurance. And I mostly focus on what's the health share. What is it? So again, it's a nonprofit, like I shared a few minutes ago. It is a group of individuals who are sharing medical costs. One of the really nice benefits is that there is no requirement for providers. You can choose anyone. You don't have to have anything pre-approved, or there's not in-network and out-of-network. Costs and coverages are the same no matter who you go to, as long as you're going to a licensed healthcare professional for whatever it is that you're seeing them for. And again, I kind of talked about the deductibles versus the max annual max that you're going to be paying with the health share. And the nice thing about a health share is their goal is to keep us as members happy and to take care of us and again, keep costs low. So claims are rarely denied. Pretty much as long as you're, again, don't have a pre-existing condition or something like that, things are going to be taken care of and covered for you. So it really helps you to put your healthcare in your own hands and really take control of that. Any questions on this part or so far?
I have just so the no deductibles thing, but the max for the year, how is that determined? How do we determine that? So basically, does my monthly contribution, uh, is that based on my max for the year?
Yes. And so I'll
Okay.
have a slide that I'll pull up
Okay,
where
great.
if you choose to have a $5,000 max out of pocket for yourself, your monthly premium is going to be lower than if you have $1,000 max out of pocket for the
Okay.
year. Yeah,
Okay. And we'll
good
talk
question.
about what that looks like.
Yep, I'll have a
Okay.
specific examples, and I think it looks like you're on your phone, so I'll actually share with you based off of your age category while we're on those slides,
Okay, great,
looking at
great,
them.
great.
Yes,
Thank you.
for sure.
I
Great
I do have a
question.
quick question, and you will
Yes.
probably get to it too, but it's just in my mind right now. So as far as like your sharing doesn't begin until you've met your annual max. Um, are there some things that do get like some of the like reimbursement, like with the holistic plans, like chiropractic, and maybe you have a few like primary care visits. Is that
Yes.
correct?
Correct.
Okay,
Yes. On the holistic side, there
got it.
are certain types of appointments or visits that are covered separate from whatever annual max that you choose. Yes.
Okay, that's a
Yeah.
major, major selling point.
I
Thank
know,
you,
right?
Lael, for asking that
Yeah,
because almost all of my visits are holistic.
right.
It's only, I mean, for 4 years, I haven't seen a medical doctor. Only until this year, I have an issue with my foot, but
Mhm.
everything has all been holistic before that.
Yeah.
Yeah.
Okay,
So
great.
the next slide here is explaining that there are options. So when you see holistic, that is your preventative care types of providers. So chiropractic, acupuncture. I feel like acupuncture is a really big one that I am grateful is on the holistic option because it has never been an option for me with health insurance for 20 years, 25 years, however long I've had health insurance. And that I've never been able to go to acupuncture and have that be covered. So that is an option in the holistic. And then the ClearShare option in this box that you're looking at here is the medical coverage. So more of the, surgeries, emergency care, the larger things, and you can get each one individually. So holistic is an option for people who are older, so 65 or older, or who have pre-existing conditions. So if somebody's currently going through cancer treatment, they wouldn't qualify for ClearShare, but they could still get holistic coverage. So you
Mm,
can get either one individually, or you can get them grouped together.
okay.
Cool.
And so then here, this one is for medical coverage only. And so Jen, in the age 50 to 64 bracket, if you were to choose a $5,000 deductible, the monthly premium would be $255. So that again, your I guess I say deductible, your annual max. It's still weird for my brain to change after so many years
Yeah.
of using that old insurance terminology. That would be the most comparable to what you currently have. So you could go from a $9,000 deductible for $600 a month to now a $5,000 deductible and pay or max out of pocket and pay $255 a month for medical coverage only.
Okay.
And then are you
Okay.
able to see on the screen?
I
Because it's kind
am.
of small. Okay,
I
cool.
am. I actually am able to zoom in.
Oh, good.
So for medical coverage only, but that also includes the holistic stuff, or is that an extra added on fee?
That's a separate plan. So I will go next
Okay.
to, so the
Okay.
next one that I bring up here on this slide is holistic only. And
Okay.
then you get it if you do them both together, it's a discounted option. So I won't stay on
Okay.
the screen too long, but since we're recording, I want to give others the option to be able
Yeah.
to zoom in and look at it. But that's if somebody knows they have a pre pre-existing condition or they're older than 65, that they could do holistic only. And
Okay.
then in the holistic and ClearShare, there are 2 options within that. So this one that I first brought up on the screen is holistic savings. So this is somebody that doesn't necessarily want as many chiropractic or acupuncture visits. It's 12 visits per year versus the full holistic plan that is 24 visits per year. So I like to explain that. And then I also actually have a screen that shows the differences. It doesn't include the breast imaging on the holistic savings option, but it still gives supplement reimbursement for people who purchase supplements from Young Living or essential oils and that. So it still has a lot of the benefits, but not quite as much. It gives people a couple of options on that. So if you were to do this one, that would give you a monthly premium at the $5,000 annual max of $298 for your age group.
And does Young Living give supplements like of most essential vitamins or just specific? I was looking at their website last week, but I don't remember seeing all the supplements. So are there, what kind of supplements? All different kinds?
Oh yeah, it's pretty extensive.
Okay.
Gosh, I mean,
So like all the
25 to 30.
supplements, like flaxseed oil, that kind of stuff, calcium.
So we don't have a flaxseed oil, but there's definitely a calcium supplement. There's digestive supplements, so enzymes.
Okay.
It's a pretty extensive. There's like daily like multivitamin, a couple of vitamin C options, vitamin B, D.
Okay. Okay.
And yeah, we have like a liquid mineral supplement. We have an antioxidant drink, a lot of different things
Okay.
that we
Okay,
offer.
good.
Yeah. Cool. And so the next one I'll go to is so the full holistic. This one is if you wanted 24 chiropractic or acupuncture visits per year, you wanted the breast imaging, IV drips are included in this, 1 per month. Very extensive. So for yourself, this would be again at the annual max of 5,000 would be $360 a month.
Okay, and I'm looking at
Even
okay, so this is interesting. Okay, so at the 5,000, if I didn't have anything big, but I did want 24 visits, then I'd be paying 360 a month. But on a
Yep.
year that I maybe wanted to do my surgery, I could go for the 1,000 still and do 510 a month.
Correct. Yeah.
Okay. Wow.
Yeah. So my family, we did the 2,500 annual
Okay.
max. And next year, I know that my husband is going to he's going to have a hysterectomy, and he has a couple of skin things that aren't covered on the holistic side that he's going to go see a dermatologist for.
Okay.
And so we're going to switch to the $1,000 in the annual max in December so that that's what we have as of January 1st. And then we're going to
Okay.
have that next year so that he can get those 2 procedures. And then there's 2 times that you can change.
I was going to ask that.
So, and change your annual max plan. You could adjust to, it's like, let's say somebody gets the medical coverage only, they can add holistic anytime. Or if they get holistic only, they can add the medical at any time. The thing that you can't change at any point is your annual max. So that part you can change at your renewal or at the end of the year. So rolling into January, or if you signed up so that your plan was active as of November 1st, you could do it in November of next year. So there's a couple of things.
Sounds great.
So it has more flexibility than traditional insurance a little bit than some of that.
Yeah.
So,
I feel like even that $1,000 annual max plan, like the rates are so affordable compared to this regular coverage that gives us none of the things we want. So it's pretty amazing.
I can't even believe it, to be honest.
I know
I knew, it's interesting. I've been talking for a year to people and I kept thinking like, there has to be something out there. There just has to be, considering how bad medical coverage is becoming.
Yeah. You're right. I personally, I knew about this 7 months ago, and I never attended one of the classes to start learning about it until July. So I knew about it for 7 months before I started. And because I kept hearing, and I'm like, that just is too good to be true. How is that
I
even
know.
real? That's what I just kept saying.
Yeah.
And now I'm kicking myself because my family of four I mean, we didn't have very good. I mean, we could go to the chiropractor 12 times a year, type of thing, but we didn't have any of the other stuff. The IV drip, I didn't have acupuncture. I didn't have, obviously, any supplement coverage, none of the proactive stuff. And I was
Right.
paying $1,500, 1,561 is what our monthly was.
Oh,
And I just kept thinking, wow, how is it? This is too good to be true. And I switched and I'm now paying 955 by lowering my deductible, getting the holistic full plan. So I have more coverage and it's 955. We're saving over $600 a month. And it's
that's
just like,
Mhm.
unbelievable.
what?
It-
You know?
and getting reimbursed for some of your supplements,
Yes.
right?
Absolutely.
Yeah.
That
So
you were
Jen,
already buying.
yeah, so I'll share with you, Jen. I've been going to Lael and Dr. Paul for
Okay.
4 years.
Oh,
I
that's so
found
lovely.
Yeah, I found her in 2020 when I
Yeah.
was pregnant with my first
I
child.
love that.
Yeah,
Yeah.
I mean, it was awesome. I actually think we met randomly on Facebook is how we met. And
I think so.
I interviewed three chiropractors and she and I just really aligned the
No
most.
pun intended.
Right.
Yes.
Yeah, and I mean, you think about it, it's COVID and trying to navigate what am I going to do and how am I going to do this and stay as healthy as possible and all of that through pregnancy and stuff. But when I went to them, so my first visit, I took my whole family with having the Healthshare in September, and I thought, I saw that I get the LMNT supplement from them, the electrolytes. And I thought, you know what? I'm going to see if I buy some of these, if it's covered as an add on. And so I told Dr. Paul, hey, I just need to make sure that it's the same receipt. So when you send it to me, make sure that this is on there. And so it was, they covered it 100%. So now I'm going to buy all of my
Yeah.
electrolytes from them. Every time I go, I'm going to buy a full box because it, the way, and let me actually pull it up. I think it's not my next slide,
That's
but oh yeah, it is.
amazing.
So right here it shows chiropractic. I'm responsible for $35 of the fee, and then they cover, that's on a different slide. They cover up to $175 per visit. So I can spend $210 per person per visit at the chiropractor for whatever the chiropractic adjustment is, plus add-ons, and get
Mhm.
reimbursed 175 of that. And so I got my supplement from Dr. Paul and
Yeah.
Lael covered at 100%. I'm like, what? This is amazing. So I like if she's thought about adding on like red light therapy, I could
Yeah.
get that and get it covered
Mhm.
100%.
I got the room all set up and it's ready to go. So we
I
haven't
can't
like,
believe that.
done pricing plans or anything, but
Nice.
it's coming very soon. So you'll have to be one of
Oh,
our first people to give it
okay.
a try.
Yes, keep me posted
So
because I
Yeah,
will.
I do
100%.
have a question. So I am coming off of a Western, an antidepressant. Um, I really don't know if it's generic or not. How does that work? I'm pretty sure I only need one more bottle and then I will be completely off of it.
Hmm.
And then that's the only medication that I'm on, but I've been coming off of it for almost 3 years now.
Okay. So if it's generic, then there won't be any fee.
Okay.
If it is a name brand, then they have discounted rates, but it depends on what the medication. So that's why
Okay.
it's not listed on here or anything like that.
Okay.
But yeah.
I'm pretty sure. How do I know whether my med is generic or not? I really have no idea.
Sometimes I think it says on the label or
Oh,
the uh, pharmacy that you get it from would be able to tell you too.
okay. Okay. I mean, I imagine if it wasn't, I'd know because I'd probably be paying more for it.
Do you know how much
Mhm.
do you pay for it right now?
Oh, it just went up, but maybe like 90 for a 3 month supply. So that doesn't sound, that sounds generic to me, right?
Yeah, depending on, I guess, your insurance, I was thinking a 1 month supply for generics is usually 20 or less. So that for 3 months, that would be, 60. So
Okay.
it might not be generic. I would definitely check.
It used to be until this year only. It went up so much, but last year
Mm-hmm.
it's always been like a $10 copay forever.
Oh,
Right.
really?
Yeah, and
That's
I
Wow.
can't
interesting.
remember what they said why it went up, but there was a reason for sure.
So a $10
Yeah.
copay is typically a generic. So
Okay,
that is hopeful, but that's a
okay.
really big increase.
It really was.
Wow.
Yeah,
Yeah.
I was kind
I
of surprised.
I think you could even probably look at the label on your bottle and just see what
Okay.
it says, because if it's brand, you'll and then type it, right, Google it, and then it should pop up and you'll be able to tell if it's like Motrin or is it ibuprofen, right? Because
Okay.
Motrin's like, do you know what I mean? Like there's a lot, you could get
Yes.
generic ibuprofen from the grocery, or you could get your
Yes.
Motrin brand or Advil brand, right? Does
Okay.
that make sense? It's the kind of the
It
same with
does.
prescriptions.
Although I don't know. I'll look. And
You just
is the IV drip for like what, why is the IV drip there? Is that for like infusions like B12?
Yep. So
mhm,
this is something that is newer to me. I just started researching and I
yeah.
talked to Lael about it, but there are different IV drip clinics, and based on your need, they can get like you can get your own little concoction made, or some of them
Mhm.
have kind of, I was looking at one over, I think in Gig Harbor, I think that Lael sent me.
Nice. Nice.
There might have been a mobile one as well, and they have some that are different options that you can be like, oh yeah, I need this and that, but B12 is one of the options as well.
Mhm.
Okay,
Yeah.
fantastic.
Like I have colleagues who are like opening up IV clinics. Like it's kind of a
Oh
newer thing
my
because basically you
goodness.
can get like IV glutathione. It gets straight into your body. You
Right.
don't have to digest it, right? So it's kind of a people just sit and do their weekly IV drips. And again, they usually get a combo kind of custom designed for them based on what they need. Or you can
Right.
get kind of single ones. It's pretty amazing.
Hmm.
That's great.
Yeah.
Yeah. And one of the things that I like on the holistic option and the breast imaging, something else that Lael and I also talked about, is you can choose, do you want a mammogram or do you want thermography?
Oh, that's
And
good.
for myself, I've had thermography twice and I paid for it 100% out of pocket. That was never something covered on health insurance, as it wasn't recognized. So I like that that is now going to be something that I can help
Yeah.
get coverage
It's
on.
really neat.
So cool. So going from the holistic to the holistic savings, the options in the holistic savings are the primary care, the supplements, and then the chiropractic and acupuncture visits up to 12 a year between the two. So it doesn't include all of the other options that are in the full holistic option.
So what's the purpose of for people getting that? Is that usually an add-on to their regular medical insurance that they'll keep paying for?
Some people, yes. So, for example, if somebody's military and they
Ah,
don't have any out of pocket
okay.
cost, they don't necessarily want the medical option because they already
Okay.
have it. Although it can be controversial. I have somebody who has medical coverage and he's like, I don't want to go to the doctors that are the military doctors. So
Right.
he's
I
like, I
don't
want to
blame
be able
them.
to go to my own doctors. So he's actually planning to sign up for both.
Okay.
To get it. So it kind of depends
Okay.
on the person. And also some people, their company might pay for a very large portion
Right.
of their medical, so then they
Right.
would only want the holistic or holistic
Okay,
savings.
perfect. That's
Right,
exactly what I was
but
thinking.
you can get, if you need your medical coverage, you can get ClearShare, which is that medical
Right.
piece, and
Right.
then you add on or bundle it in either the holistic plan, which gives you thermography and the the IV clinic, or just holistic savings if you don't want that extra coverage and just want supplements, primary care, chiropractic, and acupuncture. So it's just like a condensed version of the holistic plus plan.
Okay,
Correct.
can you just say that one more time because something did not register?
Yeah.
So what was the last one that you just offered or
Uh,
talked about?
do you, I'm trying to think. Do you have the one that shows all three? That slide again,
So
Angela?
one is the
Um,
combo, one is just the medical, and one is just the holistic, right?
Um,
within the
Right.
combo, yes. So
Yes, here
within
we
the
go.
combo, you can get the holistic savings, which is this that we have on the screen. So
Okay.
supplement, primary care visits, and then 12 chiropractic or acupuncture visits. Or you can get the full holistic option that includes the supplements, primary care visits, breast imaging, 24 chiropractic and acupuncture,
Oh, that's
plus
right.
IV drips and prescriptions.
Okay, that's
It,
right. That's right.
so it
So
just
one
kind of
of them
depends
is
on, yeah, how much holistic coverage you want. Like if you know
okay.
you're going to
Right.
use that, you might as well get the higher
Okay.
price plan. But if you're like, I just want it to like kind of help out a little bit, you can get the holistic savings.
I see. Okay. Okay. I see. I see. So the combo is the regular medical care, and then you have an option around whether you want to uh kind of supercharge your holistic
Mhm.
stuff.
Mm-hmm.
Okay,
Yes.
great. That's perfect.
Yeah.
One other difference, which I don't know if I saw specifically on here, is the holistic plan is 3 primary care visits, or no, the holistic savings is only 3 primary care visits, and the full holistic plan is 5.
Ah,
So that's also one other thing, depending on how often, like most years, I don't use the primary care doctor more than 3 times. So
right,
for me, that, but if you like know you might want to see one every other month, you might want the
right.
full holistic plan.
Okay, okay. Great.
Cool. Awesome. And then this simply outlines the supplement reimbursement from Young Living. And so for individuals, it's $50 a month. For couples and families, it's $75 a month. And that when you have the holistic option. And it's super simple. So I'll share also on my reimbursement. There's an app that you would get on your phone, and I simply take a screenshot of my invoice. Same with whether it came from chiropractor or for my Young Living supplements. I just take a screenshot on my phone. I upload the image, answer a few questions, put in my bank account so that I get the reimbursement electronically. I submitted my September stuff on September 21st. On October 7th, I think it was, I got the notification that I was going to be receiving my payment, and it was in my bank account on October 11th. So it's pretty
Wow.
fast that it
Okay,
happens.
great.
It's a very good system. I've heard from some other Healthshare types of programs that it can take quite a bit longer, or it's not as streamlined, and it was a very easy process. I was pretty happy
That's
with it.
great.
So this here shows
Yeah.
a little bit of like the what's covered by ClearShare. So again, there's no network, um, accidents, ER visits, hospital stays, surgeries. Telemedicine is 24 hours a day, 7 days a week, 365 days a year. And one of the things that's really nice about the telemedicine is that if you have a healthcare provider that you call in and talk to about something, your follow-up will be with that same provider. So the same person is with you throughout whatever it is that's going on. You don't have to re-explain the situation or depend on somebody to read notes that you're going to be meeting with somebody different later on. And then
Amazing.
I know, right?
So I'm a little confused about that. So, so we're picking our own physicians, right? Or is there a telemedicine 24/7 ClearShare physicians? Is that what you're
Yes.
talking about? Oh, there
Correct.
is.
Yeah. So part of the ClearShare
Okay.
network, there is a group of them. So you could go to like if your own provider offers
Oh,
that like remote visits or something like that, you can still go to them. But through the ClearShare program, you can get it for $0. And then same thing for mental health sessions. If
oh my God.
Right? Like that part, I'm like, that's so incredible. So, if you had something going on, then you maybe schedule with your provider in a few weeks, but you wanted to
Right.
chat with, whatever it is, like being able to have a telehealth visit in those urgent times where you're like, oh, I just need to talk to somebody. That's
yeah,
pretty
Right.
amazing. Like that's worth it right there.
yeah, for
Right.
sure.
Right. That's crazy.
Yeah.
I wonder how much those mental health therapists make.
Right?
The first thing I was thinking was like, wow, I could sign on to something like
Right?
that. Like, because the mission alone is so
Yeah.
worthy of it. But then I was like, I wonder how much money they make. Maybe not.
Worth looking into.
Yeah,
Yeah,
we'll
for
keep that
sure.
for newbie clinicians. They could do
Yeah.
that.
For sure. Yeah. And then there's a list of, I mean, you can see from the list here, they pretty much offer and cover services just like a traditional health insurance would. Almost everything is on this list that I could imagine. But I did want
Mhm.
to point out the care coordination piece. This is a really interesting piece. So it's a specific department that helps us to negotiate prices and make sure that we're getting the best prices for something. So, like you said, for example, you have an upcoming surgery in a couple of years. The care, if you involve the care coordination department at Clearwater, what they would do is they'd go to work on your behalf to make sure that the cost of that procedure, you're getting the best cost. And so, one
Okay.
example, I can't remember if this guy, it was a hip or knee surgery replacement that he needed. He was getting it signed up for it. His physician set him up for surgery at the hospital. The cost was going to be $80,000. And so he involved the care coordination department, and they discovered that this same surgeon also does surgery at a surgery center, and the cost would be $40,000. So when you involve care coordination and choose the option that they give you, because it's never required, but when you choose it, so him going to the surgery center instead of the hospital, they waive that annual max for that procedure. So let's say it was January when he got his surgery and he had the $5,000 annual max. He had zero cost for that procedure. It was waived because he saved the organization
Oh
as a whole
my God.
$40,000. Right. And there are countless examples of that. It's kind of
Yeah.
crazy. And I used to work in the medical field, so I'm not too surprised, although I am every
Right.
time I'm like, really? Is that real? Like, but I've been hearing a lot of those
Mhm.
examples, and it's kind of crazy what those costs are and the differences. So it's a really worthwhile part of Clearwater and helping to keep the costs low. Any questions on any of the coverages or anything that's listed there? Anything you don't see?
No, but I'm going to be referring like so many people to you.
Awesome.
Is that something you want?
Absolutely. I would love that and be super grateful. And so I'll share with you one of the things that you can do
Okay.
with there's two steps to getting set up is first you would set up a Young Living account. That's
Right.
whether you purchase a package of essential oils or supplements or whatever it might be, or get a free account. There's both options. So you don't ever
Okay.
have to buy anything from Young Living if all you want is the medical coverage and you don't have an interest in holistic care. That's totally fine. So you'd set up a free account, and then that's what makes you eligible for the pricing through the partnership with Young Living and Clearwater. You pay to Clearwater for your Healthshare plan, and then if you get the holistic, you buy your holistic supplements that you're going to be reimbursed for from Young Living. But as part of that, you can actually set up an account that doesn't cost you any extra money. There's no fee for it. That makes you what's called a brand partner, and you can refer people and get paid for that to help cover your costs. Like you would get money for that. So that I would love your referrals and I would give you credit for them because then
Oh
we both get
my.
so
Yeah.
Oh, I know so many people in private practice who are paying so much money for their health share, for
Hmm.
their health care. And I have clients, tons of clients too.
yeah, for
Yeah,
sure.
that's exactly what I thought when I, got into this. We have so many conversations in all my like women chiropractor groups
Yeah.
about who are you going with this year? And there's been so many discussions over the years about the different health sharing plans, but in the past like 80% of them were very like
Evangelical.
Christian, or they have certain lots and lots of
Mhm.
requirements in order to participate that like you might
Right.
read them and go, "Oh, that doesn't apply to me." And then, I read iffy stories about do they actually get reimbursed? And so there's just never been one that really resonated and felt like, oh, I feel really good about this fit. And I heard about this and I'm like, wow, like I can, tell patients about it, but also other chiropractors and friends and people that don't have that great insurance coverage.
Yeah.
Yeah. So I'm excited.
Me too. I've talked to a few other, so in addition to having my, Young Living business, I own a roofing company with my husband, and we were experiencing the crazy increases with health insurance and figuring out what we could do to save on our costs. And we know a lot of other small business owners from business networking that are the same. And so I've been talking to some of them, quite a few. I just did a presentation 2 weeks ago talking about this and a lot of them and how they can help reduce their costs as well. So, I mean, it's definitely something that as health insurance is having significant increases that a lot of people are becoming more aware of.
Well, and I don't know if you have noticed this as well, Lael, but I am having tons of clients talk about how typical labs are now starting to get rejected and denied. More
Wow.
and more, I have clients saying that they are suddenly getting things denied that were never denied before. And I feel like people are just starting to really freak out about how difficult healthcare is
Yeah.
starting to look in this country.
Yeah.
We're paying more than ever before,
Yeah,
and they're doing everything they can not to pay for the, standard things that people want and need, or they have to wait 6 months to get this MRI that has to go through this, like
right,
it's so ridiculous.
It
Yeah,
is.
right.
super crazy.
Yeah.
This is such an exciting option.
Yeah. I'm excited. So
Yeah.
I'm going to go ahead and stop the recording at this
Okay.
point. So I'll stop the screen share and then stop the recording.